This video will tell you about the anatomy of spinal cord. First, about gross anatomy. Spinal cord is a cylindrical mass of neural tissue. It extends from caudal aspect of medulla oblongata of brainstem to the level of first lumbar vertebra, that is L1. It extends from inferior aspect of brainstem, that is medulla oblongata, to the level of first lumbar vertebra. Its length is slightly different in males and females. In males it is 45 cm and females it is 42 cm. Its diameter is 1 cm to 1.5 cm. It extends from medulla oblongata caudal aspect to level of first lumbar vertebra, 40 to 45 cm in length, 1 to 1.5 cm in diameter. About regions of the spine. The regions are cervical, thoracic, lumbar, and sacrococcygeal. Cervical include C1 to C7, thoracic T1 to T12, lumbar L1 to L5, and sacrococcygeal 9 fused vertebrae in the sacrum and the coccyx. The spinal cord is securely engaged within the vertebral canal of the vertebral spine. For this reason, the spinal cord has the same areas of forward curvature, that is called a lordosis, in the cervical and lumbar region. In this picture you can see this is the cervical region and you can see lordosis here or forward curvature, and this is the lumbar region where you can see forward curvature, that is lordosis, and kyphosis in thoracic and sacral region. This is the kyphosis of thoracic region. Here is the kyphosis of sacral region, that is backward curvature. The spinal cord also follow the same curvature as that of vertebral column since it is within the vertebral canal. During the course of spinal cord, there are two points of enlargement: cervical enlargement and lumbar enlargement. The cervical enlargement is located between C4 to T1 level and lumbar enlargement is between T11 to L1 level. In this image you can see the cervical enlargement and lumbar enlargement. As the spinal cord approaches to its most inferior limit, it tapers to form a structure called the conus medullaris. So the tapering end of the spinal cord is called the conus medullaris. This is the conus medullaris. The spinal nerve that arise from the end of spinal cord are bundled together, forming a structure called the cauda equina. Whatever spinal nerves arise from below the conus medullaris form a single bundle of nerves called the cauda equina, that is seen here. At the inferior border of L1, a filamentous extension of spinal cord known as phylum terminale continues caudally to the point of insertion of coccyx. Here you can see this is the phylum terminale, that is nothing but a fibrous extension after the end of spinal cord. It consists of spinal meninges, which we will see later. So the spinal cord has two enlargement, cervical enlargement and lumbar enlargement. The end of spinal cord is called the conus medullaris, below which there is a nerve bundle called the cauda equina, and the fibrous or filamentous extension of the meninges of spine is called a phylum terminale. The spinal cord has two depressions on its surface, one on the anterior surface and the other on posterior surface. The anterior depression is called the anterior median fissure because it is a deep groove extending the length of the anterior surface. The posterior aspect there is a slightly shallower depression and that is called the posterior median sulcus. The two depressions are anterior median fissure and a posterior median sulcus. Here you can see anterior median fissure and here is the posterior median sulcus. Now about spinal meninges. Spinal meninges consist of three membranes: the dura mater, arachnoid mater and pia mater. They surround the spinal cord and they contain cerebrospinal fluid. This fluid support and protect the spinal cord. They are analogous or continuation of cranial meninges. Earlier we have seen about phylum terminale. It is formed from meninges and it form a or it become a strand of fibrous tissue. It attaches to the vertebral bodies of the coccyx. Thus, it acts as an anchor or a support for the spinal cord and meninges. About the first layer of spinal meninges, that is dura mater. It is the most external of meninges. It extends from foramen magnum to phylum terminale, separated from the wall of the vertebral canal by epidural space. This epidural space contains loose connective tissue and internal vertebral venous plexus. Here you can see the three layers. This is the dura mater external. Inner to that there is arachnoid mater. Then there is arachnoid space. Then innermost one is pia mater. First about dura mater. This is the external covering and this is the vertebral body. So the vertebral body and the dura mater is separated by a space called a epidural space, and that within the space there is loose connective tissue and the internal vertebral venous plexus. This is the anterior internal vertebral venous plexus. There is similarly there is one on the posterior side also, and this is the epidural space. It consists of fat as well. The spinal nerve exists in the vertebral canal. They pierce the dura mater, temporarily passing in the epidural space. In doing so, the dura mater surrounds the nerve root and fuses with other connective tissue covering the nerve called epineuronium. This is the example of or picture of spinal nerve existing through or piercing the dura mater. So the dura mater overlaps the root of the spinal nerve. This is the overlapping of dura mater to the root of the spinal nerve and joins with the covering of the spinal nerve. That covering is called the epineuronium. About the second layer, that is arachnoid mater. The spinal arachnoid mater is a delicate membrane. It is located between dura mater and pia mater. It is separated from the pia mater by the arachnoid space. This space contains the cerebrospinal fluid. This is the dura mater, this is the arachnoid mater, and this is the pia mater. So, arachnoid mater is situated between pia mater and the dura mater. Below the subarachnoid matter, there is a space you can see here that is called a subarachnoid space. Below the subarachnoid matter, there is a space that is called a subarachnoid space. The CSF is seen within this space. Distal to conus medullaris, the subarachnoid space expands, forming a structure called lumbar system. This space is accessed during a lumbar puncture and a spinal anesthesia. This is the extension of subarachnoid space after conus medullaris. This is the conus medullaris where the spinal cord ends. Then after this, the extension of subarachnoid space is called a lumbar system. Earlier we have learned about a procedure called a lumbar puncture or spinal tap. During this procedure, the needle is inserted into this lumbar system to get CSF. Subarachnoid space has CSF, including lumbar system has CSF. Also, the drugs are injected into this space for giving spinal anesthesia in some surgical procedures. The third layer is pia mater. It is the innermost of the meninges. It is a thin membrane and it covers the spinal cord, nerve root and their blood vessels. Inferiorly, the spinal pia mater fuses with the phylum terminale. This is the pia mater. It covers the spinal cord directly, also the blood vessel and nerve roots. Between the nerve root, the pia mater thickens to form denticulate ligaments. These ligaments attach to the dura mater, suspending the spinal cord in the vertebral canal. This is the spinal nerve coming out of spinal cord. These are spinal nerve coming out of spinal cord. In between you can see the ligament. That is called a denticulate ligament. It is formed by thickening of pia mater. So it attaches the spinal cord to the dura mater. Thus, it is suspended within the ventral canal. Spinal cord is suspended within the ventral canal with the help of denticulate ligament that is formed from thickening of pia mater. That is all about the macroscopic anatomy of spinal cord. Now let us enter into the microscopic anatomy. The cross-sectional analysis of spinal cord reveals that it is made up of a central area of cell bodies that is called gray matter. The central area of spinal cord on cross-sectional analysis is called gray matter, and that consists of cell bodies of neuron. Then the peripheral area is called white matter, and that consists of myelinated axons. In this image you can see the grey colored part which is butterfly in shape, or it has the shape of a butterfly. Please note that is grey matter that consists of cell bodies, synapses, dendrites and axon terminals. Outside the butterfly shaped area of grey matter we can see white colored white matter which consists of axon, that is nothing but nerve fibers. About the grey matter of spinal cord, as we have seen, it is butterfly shaped. It is a collection of neuronal cell bodies. Then it is further subdivided into dorsal or posterior column, intermediate or lateral column, ventral or anterior grey columns. Columns are otherwise horns. We will say dorsal horn, intermediate horn or anterior horn. Otherwise dorsal column, intermediate column and anterior column, respectively posterior, lateral and ventral. Here you can see the different columns or horns of grey matter. This is the posterior grey column or posterior grey horn. This is the intermediate lateral grey horn or column. This is the anterior grey horn or column. Coming to the spinal nuclei of grey matter. The prominent spinal nuclei, which are groups of cell bodies, are marginal zone, substantia gelatinosa, nucleus proprius, dorsal nucleus of Clark, intermediolateral nucleus, lateral motor neuron and medial motor neuron. The marginal zone, the short form is MZ, otherwise posterior marginalis. It is located at the tip of the dorsal horn, and it is important for relaying pain and temperature sensation to the brain. This is the butterfly shaped grey matter, and this side we can see the different nucleus of the grey matter. The first is marginal zone MZ. You can see here it is located at the tip of the dorsal horn. This is the dorsal horn. It is sensory in nature. It relays pain and temperature sensation from different parts of the body to the brain. Next to that we can see substantia gelatinosa. The short form is SG. Is located at the top of dorsal horn. It relays pain, temperature, light touch sensation to the brain. Third is NP, that is nucleus proprius. It is located in the neck of the dorsal horn, we say. It relays mechanical and temperature sensation to the brain. The fourth is DNC, that is dorsal nucleus of Clark. It is located in the dorsomedial nuclei. It relays unconscious proprioceptive information to the brain. Next is IMN, that is intermediolateral nucleus. It is located in the intermediate and lateral horn of grey matter, and it relays sensory information from viscera to the brain and autonomic signal from brain to the visceral organ. So this is mixed. It is sensory information to the brain and autonomic signal from brain to the visceral organ. And the last one is lateral motor neuron or mediomotor neuron, in short MNS. It is located in the ventral horn. This is the ventral horn, and it is composed of motor neuron that innervate visceral and skeletal muscle. This nucleus is motor in nature, this is mixed in nature, and the dorsal horn entire thing is sensory in nature. These are the 6 nuclei of grey matter of spinal. Coming to something called a rexed lamina. In the year 1950s, a scientist named Broad-Rext identified layers or lamina within the gray matter of spinal cord. Or Rext classification is otherwise functional division of gray matter of spinal cord. The Rex identified some different layers according to the function of gray matter, and that is called a Rex classification or functional classification of gray matter of spinal cord. It is from 1 to 10, lamina 1 to 10. In this picture you can see the Rex lamina 1 to 10. On this side you can see nuclei. We can classify gray matter according to the nuclei or according to the Rex lamina. Then coming to the dorsal column, this is the dorsal column. It consists of lamina from 1 to 6. This is the dorsal column that consists of lamina from 1 to 6, and the corresponding nuclei here you can it's named here from MC to DNC. Corresponding nuclei in the Rex lamina 1 to 6. Then the ventral column. This is the ventral column that consists of lamina 8, Rex lamina 8, see the number here, 9, these red colored areas of lamina 9, and a part of this blue colored area, part of lamina 7. Ventral horn consists of this area, 8, 9 and part of 7. The intermediate zone houses cells which belongs to lamina 7 and a part of lamina 8. The corresponding cells corresponding nuclei you can see on this side, which we have already discussed. So that is about the Rex lamina of spine. Coming to the outer layer, that is, or outer region, that is white matter. The inner is a butterfly shaped gray matter. We have seen the nuclei and the lamina of gray matter. Now let us see about the white matter. The white matter is a collection of myelinated nerve fibers. It travels to and from the brain. It will travel to the brain and as well as it will travel from the brain. Like the grey matter, it is subdivided into anterior or ventral, posterior or dorsal, and lateral segments. It is divided into anterior, posterior, and lateral segments, or ventral, dorsal, and lateral segments. The grey matter was divided into column or horns. This is divided into segments or funiculus. Anterior funiculus, posterior funiculus, or lateral funiculus, or anterior, posterior, and lateral segments. Here you can see the segments or funiculi of white matter. This is the posterior funiculus, this is the lateral funiculus, and this is the anterior funiculus corresponding to the grey matter. This is the dorsal, this is the intermediate, and this is the ventral or anterior column of grey matter. Correspondingly, you can see anterior funiculus, lateral funiculus, and posterior funiculus. Within the white matter, we have seen white matter convey information to the brain and convey information from the brain to different parts of the body. So, the white matter of the spinal cord contain a mixture of ascending, that is sensory or efferent, and descending, that is motor or efferent tract. Ascending tract are sensory in nature. They provide information from different part of the body to the brain. They carry information to the brain. They are ascending tract. Then there is descending tract. They are motor in nature, or it carry information from brain to different part for motor activities. These tracts are described according to the funiculus within which they are located. We will say posterior tract, lateral tract, and anterior tract. These tracts are bilaterally paired structures. They may cross the midline, and that is called a decussation or decussate at different levels of brain and spinal cord to information to the side of the body or from side of the brain on the side opposite to the point of origin. They may cross to the opposite side of origin. They may originate from right side and cross to left side, or they may originate from left side and cross to right side. So that is called a decussation. Then, while discussing the anatomy of brain, we have seen that the right cerebral hemisphere controls the left side of the body and the left hemisphere controls the right side of the body because the corticospinal tract decussate or cross over to the opposite side. That is why this control occurs. Then about ascending tract. The ascending tract starts with the word with the prefix spino. It means the tract is originating within the spinal tract. The ascending tracts are lateral spinothalamic tract, which means it originates from the lateral funiculus of the spinal cord. Ventral spinothalamic, dorsal column, spinocerebellar, and cuniocerebellar. The functions are different. Lateral spinothalamic carry pain and thermal stimuli. Ventral spinothalamic pressure and crude touch sensation. Dorsal column for vibration, proprioception and two-point discrimination. Spinocerebellar conduct unconscious stimuli for spinoproprioception or proprioception in joints and muscle, and cuniocerebellar carry the same information as spinocerebellar tract, that is conduction of unconscious stimuli. So these are sensory in nature. That is why it is called ascending. It will convey information from different parts of the body to the concerned area of the brain. Now let us see about the descending tract. They are motor in nature. That means they relay information from brain to different parts of the body involved in different motor activities. They are lateral and ventral corticospinal tract, lateral and ventral reticulospinal tract, rubrospinal tract, vestibulospinal tract, pectospinal tract, and corticobulbar tract. So here the word spinal comes as a prefix. That means it ends in the spinal cord and start from a different area of the brain. Then lateral and ventral corticospinal tract deal with the voluntary, discrete and skilled motor activity. Lateral and ventral anterior reticulospinal tract provide excitatory or inhibitory regulation of voluntary movements and reflexes. Rubrospinal tract promote flexor and inhibit extensor muscle activity. Vestibulospinal tract promote extensor and inhibitor flexor muscle activity. It also support balance and posture. Pectospinal tract facilitate postural movement arising from visual stimuli. The corticobulbar tract is a descending pathway, but it terminates in the cranial nuclei within the midbrain and the brainstem. About the detailed functions of ascending and descending tract, you will study in the physiology of central nervous system. Next, about formation of spinal nerves. We are still discussing the microanatomy of spinal cord. First about grey matter we have seen, then white matter, and now about formation of spinal nerves. The spinal nerves are mixed nerves. That means they carry sensory and motor information. They originate from the spinal cord and they form peripheral nervous system. So spinal nerves are part of peripheral nervous system and they originate in the spinal cord. Two consecutive rows of nerve root emerge on each side of the spinal cord. Right side two consecutive row and similarly left side two consecutive row. These nerve root join at a distance from the spinal cord and form a pair. So thus there are 31 pairs of spinal nerves. Each spinal nerve, as we have seen, it has an anterior and a posterior nerve root. These roots arise from the spinal cord and unite to form a single spinal nerve. In this image you can see there are total of 31 pairs. They are organized like this: cervical spinal nerve, thoracic spinal nerve, lumbar spinal nerve corresponding to the number of vertebrae in that particular region of the spinal cord. Then from each side two consecutive rows, anterior and posterior. After leaving the spinal cord or vertebral column, they form or they join together and again they divide into two. So anterior, there is an anterior root and a posterior root. They join together after some distance and form a single spinal nerve. Thus, there are 31 pairs or 62 spinal nerves. They are mixed in nature. The anterior root is motor in nature and the posterior root is sensory in nature. So, spinal nerve is mixed in nature. After leaving the vertebral canal, they divide into two. We have told this is the vertebral canal. They leave the vertebral canal, they join together as one nerve, and again they divide into two, posterior rami and anterior rami, to separate different parts of the body. The posterior rami supply to the synovial joints of vertebral column, deep muscles of the back, and the overlying skin. The anterior rami supply nerve fibers to remaining part of the body, both motor and sensory. The posterior rami supply only to vertebral column, muscles of the back, and skin. Anterior rami supply to different remaining part of the body, including motor and sensory. Then the nerve root from L2 to S5 arise from the distal end of spinal cord, forming a bundle of nerve as we have seen already, coda equina. This is the conus medullaris, the end of spinal cord. From the end of spinal cord, a bundle of nerve emerges and that nerves are together called a coda equina. Here you can see cervical nerve, thoracic nerve, lumbar nerves and sacrococcygeal nerves are coda equina. Coming to the vascular supply or blood vessels or blood supply of the spinal cord. The arterial supply to the spinal cord is from three longitudinal arteries. They are the anterior spinal artery and the paired posterior spinal artery. In this image, you can see the single anterior spinal artery supplying the spinal cord and the paired posterior spinal artery. Anterior spinal artery is a branch of vertebral artery. Posterior spinal artery originated from vertebral artery or posterior inferior cerebellar artery. Additional blood supply also comes from anterior and posterior segmental medullary artery and anterior and posterior radicular artery. Here you can see this is the segmental medullary artery anteriorly and posteriorly. Here you can see anterior and posterior radicular artery providing additional blood supply. About venous drainage, it is via 3 anterior and 3 posterior spinal veins. They form an anastomosic network around the surface of spinal cord in the epidural space we have seen already. Then these veins drain into internal and external vertebral plexus. Here you can see internal vertebral plexus where the anterior and posterior veins empty respectively. There is internal as well as external plexus where anterior and posterior veins respectively. Here you can see anterior spinal vein. Here is posterior spinal vein and here is the posterior lateral spinal vein and here is the posterior spinal vein. About clinical relevance or clinical implication of anatomy of spinal cord. There is something called a coda equina syndrome. We told it is a bundle of spinal nerve that arise from the distal end of spinal cord. Compression of these nerves produces a range of signs and symptoms collectively called a coda equina syndrome. Syndrome means a group of signs and symptoms or a range of signs and symptoms. So, not only one symptom but it includes multiple signs and symptoms. That is called a syndrome. Coda equina syndrome means there are a number of signs and symptoms. The main causes are compression of the coda equina including intervertebral disc prolapse, tumors, spinal stenosis, trauma or abscess formation. Generally, spinal cord disorders can be classified into outside the spinal cord and inside the spinal cord. Outside the spinal cord, the disorders include spinal injury, compression of spinal cord, blockage of blood supply that may result in spinal stroke or spinal cord infarction. Inside the spinal cord, the disorders include fluid-filled cavities called syrinx, blockage of blood supply, transverse myelitis like inflammatory disorders, tumors, abscesses, bleeding, vitamin B12 deficiency, copper deficiency, HIV infection, multiple sclerosis, syphilis, cauda equina syndrome, etc. So anatomy and physiology of spinal cord is very important to manage patients with this condition. That is the implication and application of anatomy in nursing. So thus we have come to the end of this video. In this video, we have discussed briefly about gross anatomy in terms of location, enlargement, depression, conus medullaris, spinal meninges, and spinal nerves. About microscopic anatomy, we have seen in terms of grey matter, white matter, and spinal tract. Vasculature, we saw major arteries and major veins supplying and draining the spinal cord. And disorders, we have seen the internal and external disorders. So while caring patients with these disorders, we need detailed anatomy and physiology of spinal cord. Thanks for watching the video. Please subscribe and share.